I welcome you to another series of our videos. So in this video, we'll be talking about the anatomical medical terminology. So anatomical terminology introduces and makes up a large part of medical terminology to be understood. So what we are referring to, we are referring to a medical professional at the when we say to be understood. So to be understood, you must express yourself clearly using proper terms in correct way. So this is very important as a medical professional to express yourself clearly so that you can be understood by your patients. So although you are familiar with common colloquial terms for parts and regions of the body, you must learn the international anatomical terminology. So this is very important for a medical professional. For example, axillary fossa instead of armpit. So auxiliary fossa, that is the anatomical medical terminology instead of layman's language or the colloquial term armpit. Clavicle instead of collarbone. That enables precise communication among health care professionals and scientists worldwide. So these anatomical terminology are very important because they enable precise communication among healthcare professionals and scientists worldwide. So it is easy to communicate as healthcare professionals and scientists worldwide. So it is important that we learn this anatomical medical terminology. So health professionals must also know the common and colloquial terms that people are likely to use when they describe their complaints. So as a professional, you are also supposed to know the common and colloquial terms that our patients are likely to use when they come at the hospital, when they are presenting their complaints to us. Furthermore, you must be able to use terms to people which they will be able to understand. So you must be able to use terms people who understand when explaining their medical problems to them. So this is the importance of anatomical medical terminology. So at this point, we'll be talking of anatomical positions. All anatomical descriptions are expressed in relation to one consistent position, ensuring that the descriptions are not ambiguous. So this is shown in figure 1.0. One must visualize this position in the mind when describing patients or cadavers, whether they are lying on their sides, supine, recumbent, lying on the back, face upward, or prone, lying on the abdomen, face downward. So one must ensure that they visualize this position. So the anatomical position refers to the body position as if the person were standing upright with the head, gaze, eyes, and toes directed anteriorly or forward. So anteriorly simply means in front of the body. Arms adjacent to the sides with the palms facing anteriorly. So the palms facing anterior, meaning that's anteriorly in front of the body. Lower limbs close together with the feet parallel. So lower limbs, these are just the what we normally call as legs in colloquial. So lower limbs close together with the feet parallel. So this anatomical position, we are going to see it the way it is on the following diagram. So this is the diagram showing anatomical position. So these are the feet, then this is the head. So like this is the front part of the body. So this is how anatomical position is. So we continue with our discussion. So at this point, we'll be looking at anatomical terms. So anatomical descriptions are based on 4 imaginary planes. So there are 4 imaginary planes. These are median, sagittal, frontal, and transverse that intersect the body in the anatomical position as shown in figure 1.2. So we are going to see these anatomical planes in the figures shown in the following lecture slides. So median plane, median sagittal plane. So median plane is also called median sagittal plane. The vertical plane, so this is the vertical plane passing longitudinally through the body, divides the body into right and left halves. So it passes longitudinally, it is a vertical plane through the body and divides this body into right and left halves. So the plane defines the midline of the head, neck, trunk, where it intersects the surface of the body. Midline is often erroneously used as synonym for the median plane. So the midline, let's look on how this looks like. So we would say the median sagittal plane, it's a line drawn, the line drawn on the middle here. So it divides the body, this half and this half. So that's the median sagittal plane. So we'll also look at the sagittal plane itself. So sagittal plane, it's just a plane that divides the body like this. It's not dividing the body into 2 halves, no, but it is just parallel to the median sagittal plane. Then we'll also look on how the coronal planes and the coronal planes and the transverse. So the transverse, it's like this. So let's look at them. So sagittal planes are vertical planes passing through the body to the median, so passing through the body parallel to the median plane. So this is what I'm talking about. Parasagittal is commonly used, but it is unnecessary because any plane parallel to and either side of the median plane is sagittal by definition. However, a plane parallel and near to the median plane may be referred to as the paramedian plane. So it is important to take note of these terminologies. So we go on frontal. So we'll now be looking at frontal planes. So these are also known as coronal planes. So they are vertical planes passing through the body at right angles to the median plane, dividing the body into anterior, which is front, like I've mentioned earlier, and posterior, which is back. These front and back parts of the body. So we'll look at them properly in the diagram. So now we'll look at transverse planes. Transverse planes are horizontal planes passing through the body at right angles to the median and frontal planes, dividing the body into superior, which is upper, and inferior, lower. So we'll also look at this in the diagram. Radiologists refer to the transverse planes as transaxial, which is commonly shortened to axial planes. So since the number of sagittal, frontal, and transverse planes is unlimited, a reference point, usually a visible or palpable landmark, or vertebral level is necessary to identify the location or level of plane, such as transverse plane through the transverse plane through the umbilicus. So sections of the head, neck, and trunk in precise frontal and transverse planes are symmetrical, passing through both right and left members of paired structures along some comparison. The main use of anatomical planes is to describe sections. So that is the use of anatomical plane. So let's also look at the meanings of some terms. For example, visible. When we say something is visible, it's something that you can see. Then something palpable. Palpable, it simply means something that you can easily feel. For example, the clavicle. The clavicle is easily palpable. You can easily feel it. Then also the lateral end of the scapula is also palpable. You can easily feel it. So such terms, we need to take note of them because this is part of the medical language. So we continue. So these are the three diagrams that are indicating, or that will help us to understand the planes we've talked about. So this plane here, it's the midline sagittal plane, or yes, median sagittal plane. Then this one here is just the sagittal plane. Then this is now what we called the coronal or frontal plane. So coronal or frontal plane, it divides the body into the front part and also the back part. Or in scientific terms, the anteriorly and the posteriorly. Then this is the transverse plane, divides the body into the superior part and the inferior part. Then here it divides the body into left and right part. So these are the diagrams that will help us to understand these planes. So okay, so now we will look at the terms of relationships and comparison. Various adjectives arranged as pairs of opposites describe the relationships of parts of the body or compare the position of two structures relative to each other. Some of these terms are specific for comparisons made in anatomical position or with reference to the anatomical planes. So let's look at some of these terms. Superior. So superior refers to a structure that is nearer to the vertex, the topmost point of the cranium. So this is the cranium, that's like the head there on top. Then cranial relates to the cranium and is a usive directional term, meaning towards the head or cranium. So let's take note of such terms. Then inferior. Inferior refers to a structure that is situated nearer to the sole of the foot. Then caudal or caudal is a usive directional term that means toward the feet or tail region, represented in humans by coccyx or tailbone, the small bone at the inferior end of the vertebral column. So I'm sure by now we know what a coccyx is. Then we also talk of the medial, which refers to the structure that is situated nearer to the midline of the body. Then we also talk of lateral. Lateral refers to a structure that is situated away from the midline of the body. So these are some of the terms of relationship and comparison. So at this point, thank you for watching. Ensure to subscribe to our channel.